If you think Medicare will cover all your medical bills, well, you're in for a shock. From routine physical exams for the healthy to long-term care for the infirmed, there are many items that Medicare won't cover for our nation's seniors. Hi, I'm Jeff Hoyt, Editor-in-Chief of SeniorLiving.Org. In this video, Kris Schneider, Senior Vice President of Medicare at Centerfield, explains what Medicare doesn't cover, including vision and dental care, and where you can get the coverage traditional Medicare doesn't offer without paying more. Stick around for a phone number at the end where you can get more information without cost or commitment. Because Kris is in Wisconsin and I'm in Los Angeles, we'll be conducting the interview via Zoom. Jeff Hoyt, Editor-in-Chief of SeniorLiving.Org, and today I have the pleasure of speaking with Kris Schneider. She is the Senior Vice President of Medicare at Centerfield. Welcome, Kris.
Hey, Jeff. It's great to see you today.
Likewise. Thanks for taking the time. So with a title like Senior VP of Medicare, I'd imagine you have a lot of professional experience with this program.
You know, actually, I've been in Medicare almost my entire career. And believe it or not, it's our 35 years that I've been in Medicare. And I also happen to be taking care of my father, who is in the Medicare program and aging and, trying to help him as his caregiver, make sure he's sort of navigating the quality of his life.
So professional and personal experience with it. So when people turn 65, they think, oh, now all my medical bills are going to be taken care of, but that's not really exactly the case.
Yeah. Medicare is sort of that traditional health insurance. If you kind of think about it, it provides great coverage for hospitals and when you're going to see the doctor, but it doesn't come without its own expense. There is a monthly premium that ends up getting deducted from your Social Security check that maybe people don't recognize or realize. And then when you actually see the doctor, go to the hospital, there's a lot of out-of-pocket costs that you end up having to pay for the services.
So hospital stays, you're getting lots of coverage, but what if you're healthy, you're feeling good, you want to go for an annual checkup just to make sure you're not missing anything? Is a physical covered by Medicare?
Well, very interestingly, it is not part of the Medicare program to provide a annual routine physical. They're not covered by Medicare.
Wow, that's a bit of a surprise. You'd think they want to catch disease early in order to keep the treatment costs down and the outcomes better. And what if you go to the other end of the spectrum? What if I'm in such bad physical shape that I just can't take care of myself and I've got no other caregivers in my family and I need long-term care? Is that covered by Medicare?
No, Medicare is not really a long-term care provider. There's certain circumstances where you get coverage in skilled nursing facilities, but it really isn't if you end up on the way end of the spectrum of being very unhealthy. You can't care for yourself. You can't provide your own skilled care or even do activities of daily living. Those things are not covered by Medicare.
So in my job, I have health insurance, and then I also have supplemental. I have a vision plan and a dental plan. So do people on Medicare get their eyeglasses or eye exams or dental exams paid for?
No, traditional Medicare does not provide preventative dental care or annual vision exams. It's not covered as part of the traditional Medicare program. I don't know about you, but I usually go to my dentist every 6 months for a preventative visit. That is not covered under the traditional Medicare program.
Well, lots of things are falling through the cracks here. And as people get older, their hearing tends to deteriorate. That's the population that needs hearing aids the most. Is that covered at all?
No, in fact, this is one thing I just experienced with my own father. He's on a traditional Medicare plan, and he doesn't have hearing aid coverage. So he ended up paying $2,600 for his hearing aids last year, and that was not covered by Medicare at all.
Wow. Does he use them at least?
He does. I made sure that he knew how to turn them on, how to charge them, all that great stuff.
We got no medical, no dental, no hearing aids. Prescription drugs, are they covered by Medicare?
The traditional Medicare does not cover prescription medications. You have to enroll separately in a Medicare prescription drug plan, or it can be covered through a Medicare Advantage plan that traditionally has prescription drug coverage included with it.
And then one of the joys of being a retiree is you get to travel. So what if you're on Medicare, but you're not in the US? What if you're traveling through Europe and you need medical attention? Does Medicare cover those bills?
No, Medicare is a, federal program, right? It's funded by all of the working Americans through the Medicare tax. So in order to be eligible for services paid by Medicare, you have to be within the United States.
You mentioned Medicare Advantage before, so that's not traditional Medicare. Does Medicare Advantage handle any of these things that traditional Medicare doesn't?
Really interestingly, the Medicare Advantage programs have been introduced and have been around for quite a while, and they've really advanced themselves to really go beyond traditional Medicare. It is very common that a Medicare Advantage plan has coverage for dental services, preventative dental, vision services, including eyewear, and provides annual benefits for hearing aid coverage. So those things are becoming more and more prevalent and more common in a Medicare Advantage plan, which actually goes beyond traditional Medicare.
So are people paying extra to get Medicare Advantage?
So in a Medicare Advantage plan, you're going to continue to pay the Part B premium, which is the Social Security deduction. And there is sometimes a minor premium, but very many and very common, there is a zero premium associated with Medicare Advantage. So most people enrolled in Medicare Advantage plans are not paying a premium beyond the Part B premium.
So how is it that they're able to offer so many things like dental and vision that traditional Medicare can't?
It really goes to some of the ways the Medicare Advantage program is structured. When you're in a Medicare Advantage program, there's a specific provider network that you're traditionally aligned to, which actually works very well for seniors or Medicare people that are really connected to a healthcare system. And that allows the healthcare program to actually have more dollars available to fund some of these other programs. Traditional Medicare does not have the same kind of provider network system requirements. So there's not really an opportunity to sort of use some of those savings toward other types of programs. So it has a lot to do with the way it's structured.
And lots of employee plans actually have the same thing, where in an HMO, you go to your primary care physician, you always see the same doctor first, like I do.
Yes, that's absolutely true, Jeff. I have the same exact thing. I have a PPO plan in my employer-sponsored program. So I'm very used to, here's the provider systems that I'm going to align myself to for my care. And if I go beyond that, I'm going to have a little more out-of-pocket cost. And that is how Medicare Advantage works.
And if someone wanted to know more about Medicare Advantage, where could they go for information?
So that's one of the things that I love about the work that I do is we provide great education, a lot of information, and really help individuals find the right plan for them. So I'd say call us. We're 1-800-363-9200, and we can help you find the right Medicare plan.
Great. Well, really appreciate you taking the time, Kris.
You bet, Jeff. Thanks for your time.